My name's Eyal Schechter. I'm an ENT consultant. I work at Chase Lodge Hospital and also in Luton and Dunstable for my NHS work. But I knew I wanted to be a surgeon fairly early on, having been in an operating theatre and just loving the vibe that was in there. And then one day I saw a professor up in Manchester rebuild a nose using somebody's forehead. And I walked out of the room, called my mum, like, I'm going to do ENT, and spent most of my years in training thinking I was going to specialise in noses. But then, as most surgeons probably have, got a bit of an ego, and I ended up winning a dissection prize for my ear surgery. At which point, my head was turned. I was determined to be an otologist. What I love about ENT is the fact that even though it's a surgical specialty, there's so much you can do in clinic. It's really great to be able to help people there and then, as well as recognizing when somebody's got a bigger problem that needs sorting. There's nothing better than seeing somebody post-op or somebody after you've done an interventional treatment in clinic and you've completely got rid of a problem that's been bothering them for years. Obviously, the more urgent side of things as well. At ENT, we can still deal with cancer, we can still deal with those kind of issues. Obviously, you get that a different sense of reward. Literally come to you having had significant reduction in quality of life for decades sometimes, and to be able to help them with that is really quite amazing. I think one of the things I'm particularly good at is listening. I get a lot of feedback when it comes to kind of the end of year reviews and we have to collect patient feedback. One of the things patients often say is that I take the time to listen to them, but also take the time to explain things to them. I've never been one for just saying, this is what we're going to do because I want to. I like to talk through options. I like to talk through my reasoning for why I think a certain thing. But also, as I said, if I'm listening to what's coming back to me, it's really helpful to try and build a plan together.